We are here because we got so many great questions when we had you on as our featured guest for the Live Well Today webinar. I think it was in November, right?
Yep.
And we didn't get a chance to answer all of them, so we're going to do a quick lightning round today just to get through some of those other questions that were asked, so we can, answer these important questions that were asked of us. And so let's go right to it.
Oh, bring it on.
Jori, what medication is good to help people if they're having some issues with their memory? Is there a good medication for that?
So this is a really important and really common question. So right now, in terms of Parkinson's, the medications that we have for memory. So there's one that is technically approved for Parkinson's specifically, and that's rivastigmine. But that is part of a category of medicines called the acetylcholinesterase inhibitors. It's a long name. That is rivastigmine, or the brand name is Exelon, or donepezil, the brand name is Aricept. And you might think, well, I've heard of those medications, but I've heard of them for Alzheimer's. That's where they started. We have conscripted them and used them for people with Parkinson's. And the way to think about these medications in general is if people are starting to notice some changes in memory or thinking, we think about these almost like a vitamin. They're not a vitamin, but what I mean by that is we know that they are doing something underneath on a microscopic level that is slowing down how quickly memory and thinking would be changing otherwise. On a day-to-day basis, a month-to-month basis, a person might not notice any change taking the medication, or they may say, I feel like things are still getting worse. However, because Parkinson's is a progressive condition, we don't have a way to know, well, what would you look like 6 months from now without the medicine? And so we do tend to reach for those. And in some people, we will see some stabilizing of memory or thinking changes. And in a small fraction of people, they can see improvement. So usually the side effect profiles are pretty benign. And so they are good medicines for us to reach for.
Well, great, thanks. So it's nice to know there's something that can help, at least potentially. And the next question I had for you relates to that. Potentially, maybe it relates. You tell me if you think this is true. But another question we had was, do you recommend that people pursue a sleep study? And the reason I thought this might relate is that I know I have trouble with my memory if I don't sleep very well. So do you recommend a sleep study to potentially help people understand what's going on generally or with their memory?
It's a really important question. So I think it depends on what symptoms are going on. If, for example, the person with Parkinson's is gasping in their sleep, is stopping breathing intermittently, right? People with Parkinson's are more likely to have sleep apnea, which is where you stop breathing during sleep. Absolutely. Yes, if that's happening. If the person with Parkinson's doesn't think it's happening, but a bed partner or someone else in the household hears them, that's enough for me to say, yep, we need to get a sleep study. Because sleep apnea is treatable. If we don't treat it, it has some pretty serious risks and consequences, including memory and thinking, including a lot of daytime sleepiness. It raises high blood pressure, all kinds of bad stuff that is treatable. If someone on the flip side is having, vivid dreams or they're acting out their dreams during sleep, sometimes we can confirm that that's going on with a sleep study, but I think many of us won't necessarily get a sleep study just for those symptoms. We'll just go ahead and treat. If someone has that REM behavior disorder where they're kicking, they're thrashing, they're punching, they're talking in sleep, I think most of us wouldn't necessarily get a sleep study just to kind of prove that point.
Okay, so are there any other sleep disturbances that might impact this decision? Or are those the two big ones?
I think those are the two big ones. Sometimes people, bed partners most often will notice a person kind of just jerking their legs or moving in sleep, not running or, acting things out. That's called periodic limb movements of sleep. So sometimes someone might get a sleep study because they're not sure what's going on, and that could be distinguished there. Or someone might be complaining of restless legs syndrome, which is more so when the person's awake and their legs feel sort of this creepy, crawly, uncomfortable sensation. You move them, it relieves that feeling for a bit, or you have to get up and walk around, but then it kind of comes back, usually late in the evening, sitting on the couch watching TV or getting into bed. So if that's going on, we can pick that up on a sleep study as well, and that may help decide treatment. So Parkinson's really messes with sleep in lots of different ways. A sleep study is one of those, tool pieces in the toolkit that can help us kind of figure out what exactly is going on so that we can personalize the treatment.
Great. Okay, thanks. So this next question also maybe relates because so many wearable devices can track sleep for people. And the question we received was, do you recommend any wearable devices for monitoring symptoms or to call for help in the event of a fall or something of that nature?
Yeah. So I think the or there is really helpful. There is a huge amount of research going on. There's so much interest in wearable devices, right? I've got an Apple Watch. People have all the different rings and the various different things. I think there's tremendous promise for those to help. I think right now, many of them generate a ton of data. Um, but unfortunately, the recipient, right? If you're trying to send, here's my the last 6 months worth of how I've been sleeping to your movement disorder doc, they don't have any time designated to be able to review any of that, right? And so if it's helpful to you, that may be great. I would say right now, I don't know that we're at a place where some of those wearable devices are helpful as much for reporting on daily kind of symptoms to your healthcare provider. But if it's helpful to you, fantastic. If it's motivating to you, fantastic, especially things that might motivate you to get up, to take meds, to exercise. The flip side of that question, the or piece about what about calling for help? What about falls? That's where I think that a lot of these devices can be really helpful right now. So if someone lives on their own, or if someone is frequently on their own, they've got a care partner, but the care partner maybe works outside of the home, um, or the person might be alone overnight. I think that having a device that the individual could use in case they fall, or in case there's an emergency is very helpful. And I have lots of families that are like, meh, but I always have my phone with me. I don't let go of my phone. I promise you that if someone falls, even if the phone is in their hand, it is not impossible that the phone skitters away just out of reach. So I do think in our frequent fallers or people who are on their own, having something that is on them, whether that's a pendant, whether that's a bracelet, whether it's a watch, whatever it is. And if a person with Parkinson's is starting to have um, episodes of driving and getting lost, or episodes of wandering outside of the home, absolutely having a device that has tracking capabilities is really important. So again, there are, commercially available just watches that can do that. There are a lot of different medical alert systems that can also do that too. I've had families where they might get those little tiles, which can be sort of GPS tracked, and they might put those inside their loved ones, like the soles of a loved one's shoes, if they typically wear one particular type of shoe. Not going to help with falls, but in the event that someone wanders off, those can be really, really helpful. So we hope that we never have to use them. I would think of these as kind of like an insurance policy.
So I'm just going to add something real quick that I actually recently got my first Apple Watch. And not that we need to call out the brand in particular, but each brand has its own settings for these sorts of interventions, and so I think you want to make sure you have those things turned on if you're going to try
Yes.
to use them for this. Because if you think it's doing, and that can be a little tricky sometimes. So, the internet's your friend, I guess, in that regard.
Yes, call your favorite IT person, call your favorite child or grandchild, to set all the notifications and things appropriately. There are some systems out there as well. I know I have a lot of folks who are like, I don't want it to automatically call 911. There are some alert systems where you can set it to automatically call person number one, whether that's a care partner, whether that's, whoever that is. But if they don't pick up or if there's a delay, it will reroute the call to 911. So I think those are options too.
Yeah, that's another thing just to quickly draw attention to, which is that if you're not in proximity to your phone and you don't have a cellular capability on the device, it may not actually make that call. So it might be worth thinking about if you are going to try for this utility, make sure you're buying a device that actually has the function you think it does, and don't just assume that every watch or whatever device you're looking at can do that. And you might want to make sure you get one that has the cellular capability if that's available to you.
100%.
Okay, so last question in our lightning round today, and this one's a little bit off the trend we were on with regards to, we had a nice run there, but now we're going to go a little bit different subject. Are there common Parkinson's medications that cause constipation?
For the most part, I would say no. the Parkinson's medicines do not typically cause constipation. Um, so amantadine would be kind of an outlier. Amantadine sometimes we use for tremor, often we use for dyskinesia. Amantadine can make constipation worse. But most of the time when people are asking me this, it's wanting to blame it on one of the medications because then we can kind of, we can just take that medication away. But for most people, the majority of the time, it's actually the underlying Parkinson's that's causing constipation. However, that's really treatable. So there are a lot of non-pharmacologic things we can do, preventing it. So hydration, 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 fiber through food, ideally, rather than like a powdered fiber supplement. Hydration, fiber in food, and exercise are going to be sort of setting the baseline to try to keep the gut going as regularly as possible. And then we can add on things like prunes or prune juice or other dried fruit, fermented foods like sauerkraut, kimchi, things like that can help with the gut and some of those over-the-counter treatments for constipation. One of the things that usually goes with this, and one of our sort of go-to most reliable treatments is something like polyethylene glycol, which the brand name for that is Miralax. And most drugstores will have the powder with a purple cap on it, whether you get the store brand or the brand name. And what I'll say that we hear from a lot of our folks about that one is I took that once, I took that for 2 days, and then I had bowel incontinence, or then I had diarrhea. It was too strong. And I hear you. And here is why, number one, that particular thing, Miralax or polyethylene glycol, is both our safest and our most reliable and our most powerful option for constipation. It's the thing that pediatricians will give to kids with chronic constipation for years. So that's sort of my barometer of stamp of approval. But the issue with constipation and the reason why this sometimes people will complain of bowel incontinence if we don't manage appropriately is because untreated, constipation is the gut moving really, really slowly, stool moving through, and it basically becomes this increasingly dry, increasingly hard boulder. Picture sort of slow motion Indiana Jones. Okay, that boulder rolling through and it grinds to a halt. It gets stuck. At some point, that stool can't even get out because it's so rock hard, right? Miralax is going to bring water into the gut, but it's going to bring it up, high up in the gut. It's going to soften up the newer, fresher stuff first. And so what often happens is that may sneak around the boulder and come out as bowel incontinence, as the person maybe doesn't even have a warning, or they have a very short warning and then, they lose control of their bowels. And folks will go, I took too much, and then they'll stop it. And even though it sounds crazy, the answer is actually to continue taking the medicine. We want to get that Miralax to that giant rock hard boulder, get that out of the way, and then kind of regular normal things can resume. And sometimes the reason people have that incontinence is there are muscles there that need to squeeze. There are muscles there that need to relax, right? You're at home, no one's watching you. You can practice making sure you know which muscles those are, right? If you've got a big rock hard boulder of stool that's sitting right there at the outlet, it is actively stretching those muscles out of their normal shape and function. And so often you can't sort of control things until you get that boulder out of the way.
So I guess this question started with something about, the question started with about Parkinson's medications causing this, but actually, in fact, it's important that you maintain your Parkinson's medications to make this process work more smoothly because you have to. That's going to help your muscles in your abdomen and your gut work more effectively, right? So it's important not to stop them.
Absolutely. Absolutely. And if there is a question about, oh, I wonder if this medication, is causing any symptom, right? I would say contact your healthcare provider, contact the person prescribing it before abruptly stopping things, because there are some of these medications and there are some side effects where it seems like, we get into a lot of correlation versus causation, right? I started this thing and then this thing happened. It must be this. I'm going to stop it. But actually, if we would have continued, we would have, broken through and gotten the relief that we were looking for. So, if there's a question, reach out to the person who prescribed it, and ask before stopping anything new, anything like that.
Yeah, great. Well, thanks for taking some time to run through this lightning round with me, Jori. And is there anything else you want to add to any of these questions, or did we cover the things that stood out to you from that webinar?
I think we got them. Keep the questions coming. And I'm just always amazed the community has so many fantastic questions and insights. And, so keep it coming. You keep us on our toes.
All right, thanks, Jori. We'll look forward to talking with you again very soon.
Sounds good. Thanks so much, Chris.